So what I love most about Kaiser Permanente are the people, the doctors, the physicians, the staff. Everyone here is really excellent and everyone's working towards the same goal, which is providing the best care for our patients.
One of the things I really like about Kaiser Permanente is everything's internal. If I have a patient who needs to get an emergent CT scan or lab work, most of the time it's in the same building. They don't have to drive all over town, and it's just super convenient.
Another great thing about working for Kaiser Permanente is that they're innovators in the field, such as being able to adapt this new technology that we were able to modify for something totally new and novel to take care of patients. Truly provides the most state-of-the-art care.
Another reason why I joined Kaiser Permanente is because, quite frankly, they were reputed to have the best cardiologists in the city, and I wanted to be part of that group. By far, this is the best group of cardiologists I have worked with.
That's the best part about medicine at Kaiser Permanente. I mean, really that one-to-one connection with your patient and feeling like you made a difference and you changed their life. That's huge, and that's why we all went into this field.
All righty, I'm going to go ahead and get us started. I've got 12 o'clock on the dot here. First of all, thank you to all of you who are joining. As others get on, thank you for coming in a little late. That's all right, even a little late, we'll take you. And I want to thank Kaiser Permanente for the sponsorship of our Little Talks. I do want to make a few just kind of logistical comments. Dr. Joe Nassaro is good with us asking questions during his presentation, or we could save for after. There is a Q&A kind of little icon that's near the bottom of your screen. So if you kind of take your mouse and kind of go down, it should pop up and you can see that. You can click in there and put questions, type your questions in there, and I'll keep an eye on those. There is also the option, if you're, again, with your mouse kind of scrolling over, it says more, and it has like 3 little dots. If you click in there, there is also the option that says raise your hand. It's kind of near the bottom. Feel free to hit that, and I will also keep an eye on that. And I will then ask if you would like to ask your question. So keep an eye on that as well. Then the other thing is, I do want to do one last reminder that we do have our virtual excursions this afternoon at 4:30, and that is with a partner, Union Bistro, and they're going to be doing and showing us how to cook with a lot of different types of squash. So if you can join that as well, we'd love to have you. And if you are interested in that, you can email me at Tanya, Tanya, at alittlehelp.org, and I'll go ahead and get you that link and get you signed up so you can attend that at 4:30 this afternoon. All right, that's kind of my little logistical updates. Let's get us started on our little talk and brain health. I'm very excited to introduce Dr. Joe Nassaro from Emory University. He is an expert in this field, and I'm going to let him go into his many accomplishments. That might go on for, I feel like, 10 to 15 minutes, but he can maybe shut that down for me a little bit. But he is a very accomplished and an expert in this field, so I'm very excited to have him. Joe, I'm just going to hand it over to you.
All right. Thank you very much. Thank you for the invitation. I really always appreciate getting out and talking with the community. So very, very excited to be here, share some of my work and my passion. Let me go ahead and share screen and bring up my slides. That'll allow me to tell you a little bit about my background and what I'm doing. So I'm going to talk about exercise prescription for brain health. Again, absolute passion of mine, and I'll talk a little bit about how I got here. I'm currently an associate professor in departments of neurology and rehabilitation medicine at Emory, and then I'm also serving as the interim Executive Director for the Center for Visual and Neurocognitive Rehabilitation, or the CVNR, which is at the Atlanta VA, the Department of Veterans Affairs. Really honored to be part of that center. It's one of only 14 rehabilitation centers in the nation, and being able to serve as the interim director has really been a great experience for me. Because I'm with the government, I do have a disclosure, so the presentation is prepared by me. My personal capacity and my opinions expressed are my own and do not reflect the view of the United States government. But I do like to tell people that I work for the government, and so I'm here to help. So typically get a good laugh out of that. But again, really, really happy to be here with you all. So I started out when I first got to college. I was working in sports medicine and got some really, really phenomenal experiences in sports medicine. I was out west at UCLA. I was working with the football team and the track and field team, and working with athletes, trying to make them bigger, faster, stronger, or rehabilitate them back from an injury. And really enjoyed that. I moved on eventually to get my work on my master's degree. Also, again, working with football teams and track and field teams, again, with the same intent, rehabilitation, trying to take very young, fit athletes and try to make them bigger, faster, stronger. This opportunity came with some additional opportunities that I greatly enjoyed, but one of which was working in the NFL. So I got an opportunity to work as an athletic trainer for the San Francisco 49ers. Really enjoyed that. But I think that was the time point when a couple of things started kind of changing for me in terms of what I wanted to do for a career. And I'll get into that a little bit. Some other opportunities that came with doing athletic training was working with the exports, extreme sports. So there's an image there of that skater. That was quite an experience, considering those guys are flying about 20 feet in the air and coming crashing down. So that kept me on my toes in terms of trying to keep them safe and healthy. And I also got to work with the Red Hot Chili Peppers. I don't know how many of you are familiar with that band, but Anthony Kiedis, the lead singer, the gentleman jumping up and down there, he actually during his concert, he runs and jumps around just like a professional basketball player. And so before every concert, he actually gets his ankles taped just like a basketball player would. So he has athletic trainers that work on his staff. And so I got to be one of those for a little while, which was really unique experience, interesting experience. So I mentioned kind of after my time in the NFL, realizing that, while I loved athletic training and taking concepts of rehabilitation and strength training, it was really a passion of mine. But there was a part of me that wanted to take the information that I was learning and apply it to populations that maybe were in more of need. I enjoyed working with athletic populations, but I thought maybe, I could take this skill set that I had learned from a standpoint of rehabilitation and sports medicine into patient populations. I wasn't exactly sure what patient population that was at the time, but I started searching around, and I eventually came to an individual at the University of Georgia, Michael Horvat, who was doing some really interesting exercise research in Parkinson's disease. And that was kind of exactly what I was looking for. Again, a patient population that would allow me to take my skill set and apply it to a group that was really in need. And it turned out to be a really excellent experience for me. Got my PhD, designed a home-based exercise program for individuals with Parkinson's disease that was designed to improve their mobility and lessen their fall risk. Again, a great experience, was really happy with that. But an interesting thing happened. And as I was working with Parkinson's disease, which is a movement disorder, it's a neurologic disorder, was I realized that all of my training to that date had been kind of from the neck down. And I realized that I didn't know what was going on. I didn't have a full appreciation of what was going on from the neck up. And so again, kind of wanting to expand my toolbox and my skill set, I went on to the University of Florida in a neuroscience program. And the idea was to take my skill set in rehabilitation, strength training, sports medicine, and combine it with neuroscience so that I would really have a greater understanding of the implications for movement and disability from not only the neck down, but also from the neck up. And that would help me with movement disorders, neurologic disorders, particularly neurologic disorders that are related to aging. And so another great opportunity for me. And that really got the work that I'm going to talk about today going in terms of working at the University of Florida. So I'm going to talk about, brain health and some of the work that we're doing, that trying to identify and shed light on why exactly the brain is so impacted with exercise. But I do want to just start with kind of the things that all of us know, but I think they're just so potent, and it's always good to highlight these. So heart disease, sarcopenia, so that's muscle wasting, diabetes, blood pressure, weight control. These are huge problems in our current healthcare system. It's not only financial, but the impact they have on people's quality of life and their health, their overall health. And all of these are positively impacted with physical activity. And so, the way that we prescribe activity, hopefully improve our outlets to activity, which I'll talk a little bit about, is critical to address these. And what's really interesting is over the last probably 20 years is that we've started to see more and more that there's, in addition to these positives, that there's a positive on brain health. And this idea is not necessarily anything new. I'll talk about how far it goes back, but research is really starting to highlight the importance of brain health with exercise. And on the opposite end of that coin is physical inactivity. And there's also a growing body of science and research that is really indicating how bad it is to have a sedentary lifestyle. So this is just a table showing the higher the number, the greater the risk. So high number, bad. We're all probably very well aware of how bad smoking is for us. That's pretty much always the benchmark of how terrible something can be for our health. You could see that number at 1.56. Well, just under that is physical inactivity, and just under that is being obese. That's another one that when it comes to our health outcomes, we know how bad it is for you, but you'll see right in between smoking and being obese is living a sedentary lifestyle. Some others on here: high blood pressure, high cholesterol, diabetes. Again, these things are very negatively impact health quite a bit, but physical inactivity is up near the top. So, we have to try to limit the amount of inactivity that we have, particularly as we age. And in fact, 250,000 premature deaths in the U.S. every year are attributed to physical activity. And then, many of the things listed, not necessarily smoking, but weight control, blood pressure, cholesterol, diabetes. These are exercises often serves as a primary treatment for those. So just, more related to some interesting data related to inactivity, and this one's on sitting. So what they did was they tracked over 17,000 subjects from age 18 all the way to age 90. So this was a large cohort of people all across the adult lifespan. Followed people for average of 12 years. Over that time, there were about 1,800 deaths. And one of the main outcomes that was related to issues of cardiovascular disease and all-cause mortality, so death, was how long individuals were sitting. So, over the last few decades, our workforce or society has changed in that we have a lot of people that are sitting throughout the day, and this is really negatively impacting health outcomes. And again, just related to that inactivity profile that many people have. So when we talk about brain health, and exercise. Whoops, sorry about that. I'm trying to move one of these outcomes. There we go. Oh, so when we talk about brain health, the thing is we do have situations which, as individuals age, we get a change in their cognitive function, so how their brain behaves. And you can see there's numerous different outcomes on here: reasoning, processing speed, memory. But the red line is sort of an average, and as you can see, starting about age 30, things begin to decline from a cognitive standpoint. And this is normal aging. This happens as a part of aging, but there's not very many treatments to address this, to slow the decline. Obviously, if you introduce dementia, mild cognitive impairment, Alzheimer's disease, this red line would be accelerated and would have a steeper slope. And again, there's not very many treatments. And so, exercise has long been thought to be maybe one of the potential ways to decrease cognitive decline and even address some dementia risks. So this study here was looking at the amount of people reported how often they're physically active, and then the onset of dementia. And so what you see here is that those that exercise, that reported exercising 3 or more times a week, were more likely to be dementia-free as they age. So if you look at the red line, the dementia risk stays at about 0 until just about a little past age 80. And once it starts going up, that's when the incidence of dementia goes up. And so those are the people that exercise 3 times a week. Whereas if you look at the individuals that exercise less than that, their risk starts to go up in the early 70s, 72, 73-ish. So really interesting finding here in that, those that exercise 3 or more times a week were more likely to live longer without dementia than those that exercise less than that. And so, the question for a really long time has been, well, what is it about exercise? And I've alluded a couple times to this, that this idea is actually, from a research standpoint, about 20 years old, maybe a little bit older, that 30 years old, but it's the idea that exercise supports brain health goes back way further than that. And in fact, the ancient Greeks had such an emphasis on sports, not necessarily because, well, for one reason, it made for a stronger soldier, but they also thought that it made for a soldier that was more capable of learning. And so, that's just one of these early indicators that there's something between this relationship between being active, exercising, and having a healthier brain. One of the very, very early studies was, from a science standpoint, was done in 1975. Juanita Sperduso, she was walking through a fitness facility at the university she was working at, and there was retired faculty that were playing racquetball. And she was a neuropsychologist, as I understand it, and she sort of paused and was watching them, and she thought to herself, those retired faculty look different than sedentary retired faculty that I know. And she didn't mean how they looked physically. She was talking about how they were reacting to the ball. So reaction time, and reaction time is actually a very crude and strong measure of central nervous system functioning. And she thought that those retired faculty that were active had faster reaction times than those that were sedentary. In fact, so she designed a study around exactly that and showed exactly that the retired faculty that were physically active were more had faster reaction times, so higher levels of central nervous system function than those that were sedentary. So this was a really interesting study from 2003 by Stan Colcom. So what you're looking at here are these yellow areas. These are 2 different ways to look at the brain, white matter and gray matter. And these areas that kind of look like fire, these are areas of the brain that atrophy, that shrink as we age. So this is a normal part of aging, not necessarily a good thing. It doesn't have to involve pathology or Alzheimer's disease, but it does in fact happen with aging. So these are areas of the brain that shrink as we age. And as you can see, it's most of the cortex, so this lower one here. But what's really interesting, he took a group of active older adults and also scanned their brains and found this. And if you're curious what this is, these are areas of the brain that are spared from atrophy in individuals that are active, that have high levels of physical activity as they age. And you see they map almost identical to one another. So those areas that are of the brain that are susceptible to age-related atrophy, that atrophy is spared in those individuals that are physically active as they age. So really, really interesting study. Now, one thing to highlight about those 2 studies that I just talked about was they're cross-sectional studies. And what that means is you just take a group of people that have a certain characteristic and you study them. And so some of you may be thinking, well, if you just look at people that have higher levels of physical activity and compare them to sedentary people, there's a good chance there's other factors involved, right? So if we think about our sedentary peers and think about our very active peers, there's other things other than just exercising. They may be more likely to eat healthier. They may be more likely to drink less. They may be more likely to sleep more. So other factors that may impact brain health and cognitive function other than just exercise. These 2 studies here are really the seminal work that have really driven home the point that exercise can indeed impact brain health. And these 2 studies here are what really got me on kind of the path I am on currently. So in 1999, Art Kramer took a group of 126 older adults that were sedentary. So every one of these older adults was sedentary, low levels of physical activity. He broke them into two groups. One group remained sedentary. The other group began an exercise program, a 6-month exercise program. After that 6 months, that group, the aerobic training group, showed substantial improvements on performance and the tasks required executive function. So these executive tasks, these are very commonly used in daily activities, tasks that we use when we're planning, when we're sort of taking in information, utilizing that information, updating that information. So these are working memory tasks, inhibition, very, very commonly used cognitive tasks. And this group, this aerobic training group, improved on that, while the sedentary group remained the same. Stan Colcom, the same individual that I highlighted the brain atrophy studies in, he followed that cross-sectional study and took, again, a group of all sedentary older adults. This exercise program was 1 year, but what he showed was that those that were randomized to the exercise group showed significant increase in brain volume following the exercise program. So not only did it slow the atrophy, the age-related atrophy, but it actually increased the volume of the brain in particular areas. And I highlight those here. This right inferior frontal gyrus, and this is an area that's really important for language function. I'll talk a little bit about our work that's kind of continued on from this. So these are really, really exciting studies. These are studies that have kind of set the stage for a lot of the work that's going on now. And one of the questions is how is this happening? What is it about exercise that causes the brain to be healthier? And that's what's called, what is the mechanism? So we're very interested in figuring out the mechanism. And the reason that it's really important to understand mechanism is because if we know why and how these things are happening, we can better target treatments, and we can better target individuals, and we can better target exercise programs so that we can really move the needle on improving overall health, quality of life, and reducing risk of neurologic disease. So understanding the how is really, really important, and where much of my work is focused. So I mentioned the Atlanta VA Center that I work in, the Center for Visual and Neurocognitive Rehabilitation. We have a core, so it's made up of these cores, and one of the cores is the physical exercise core. We also have a neuroimaging core and a molecular biology core. And so the intent of this exact thing, what we're doing every day, is enrolling older adults, whether they're aging healthy, whether they're aging sedentary, whether with a sedentary lifestyle, whether they have Parkinson's disease, mild cognitive impairment. We enroll them in exercise programs, and then we study them. We do brain imaging. We do blood draws so we can look at different chemicals in the blood to see what's changing. And so now I'll talk a little bit about some of that work. So here is this top two, and I really hope you can see my pointer, but if on your screen, it would be the two brains on the right. You can see there's these two red areas. And so one thing that we do is look at functional brain imaging. And so this is when we put somebody in the brain scanner and we have them do a task. We can actually show changes. I have some more data on this, but we can show changes in how the brain behaves following 12 weeks of exercise. Our exercise programs are 12 weeks. We exercise them 3 times a week. And so I'll show you some data that we shows that the brain behaves differently following exercise. It actually behaves more similar to somebody that's slightly younger. Here on the other side is looking at some neurochemical makeup of the brain before and after exercise. So there's GABA, which is a chemical in the brain that helps with inhibition. Inhibition is very, very important. So if you think about doing something with one hand, our brain sometimes works in a way that both sides of the brain can be activated at the same time, and oftentimes that creates these mirror movements, what are not necessarily good patterns of activity. And so exercise increases GABA, and we think that increase in GABA actually helps with this inhibitory pattern of the brain, which is really, really exceptional and important outcome. The bottom two are looking at vascularization. So Alzheimer's disease, for example, is heavily tied to the vascular, how the blood vessels of your brain work. And we can actually study how the vessels behave in your brain, both before and after exercise. So we can take people while they're in the brain scanner, they breathe in CO2, a small amount of CO2, and we can see how their brain vessels dilate in response to that. And following exercise, we can measure if the vessels have become more healthy because of that exercise. And then the last one, the bar graph on the corner here, that's looking at perfusion. So actually how much blood is going to the brain. So it's, if we're having in an aging state where our vessels are kind of older and maybe have plaques or, not as smooth flow with blood going to the central nervous system, and we can actually measure that as well. So here's some really interesting data from our lab from a few years back. So this is looking at a young individual and an older individual. The young individual, the two brains on the top. So they're in the scanner and they're doing a language task. So they're coming up with categories in a certain a category of a certain word. So if I told you supermarket items, you would name items of the supermarket. So what happens when you have a young person in the scanner doing this task, the left language areas on the brain light up. And this is exactly what you would expect to see. These language areas are also implicated in a stroke. So somebody that has aphasia would be have a stroke on the left side of the brain here. In an older adult doing the exact same task, what you see is activity begin to show on the right side. So not only do you get the activity on the left side of the brain, you get activity on the right side. Excuse me. Oftentimes we think, well, there's more activity, maybe that's a compensation. The problem is the more activity you show on the right side during this task, the worse your performance is. So this right side activity, the brain activating on the right side, is not good for performance on the task. So it's impacting language function. After 12 weeks of exercise, what we show in previously sedentary older adults that go through 12 weeks of exercise, we show that there's less activity on the right side. So less of this right side activity, which is a pattern of inhibition. Again, a pattern that you would similarly see in a young person. So that is a good thing. And what's even more important is that their performance, so their ability to generate these words during this task, improves. So it's not just how the brain looks in a scanner, that's great, but we want how people actually perform and function to improve, and indeed they do. So there's a really interesting finding with motor function. So this is a hand, we have somebody in the scanner doing a hand moving task. So here they're doing a right-handed task under the younger brain. And what you see is activity on the left side. That's the neuroanatomy of the brain. If you move your right hand, the left side of your brain lights up. On the right side here in the blue, that's again an inhibitory pattern of activity. And that's exactly what you want. You want to be able to do a unilateral hand movement. You don't necessarily, if you're trying to move your right hand, you don't necessarily want your left hand to start moving as well. And that does happen as we age, and that's called a mirror movement. In older adults, you can see that both sides of the brain are lighting up. So again, they're showing this pattern of activity, just like in the language system where there's bilateral activity. But what happens as a result of exercise is that we begin to show this pattern of inhibition again, following exercise, 12 weeks of exercise, which again is a really good thing and similar to how the brain behaves in a younger person. So exciting findings from our brain imaging work. We have, like I mentioned, we have the vascular work as well. That is also indicative of a younger, healthier brain following exercise. Hopefully, that's the goal of all that is to try to figure out what the mechanism behind all this is. And I typically, after talking to folks and presenting our data, for in-person hand to go up, or maybe there's one in the chat now, and somebody says, okay, well, you're telling us exercise is good for us, but what exercise is best for me? What should I do? Should I be, join a gym, work with the trainer? Should I be riding the bike? Should I be jogging? Should I be walking? And so I try to usually address this question as well. And the fact is the answer is pretty easy. The exercise that is best for you is the one that you enjoy. So there's a lot of different options when it comes to increasing physical activity and being, getting involved in being more active. The one thing that we know for sure is that if we put somebody on a treadmill and have them walk on the treadmill 3 times a week for 12 weeks and they don't like the treadmill, they're not going to do it. So we're always looking for ways to increase people's engagement through activities that they enjoy. Now, there are specific types of exercise that one should do. All of our studies follow the guidelines provided by health.gov, American Heart Association, American College of Sports Medicine. And what these recommend is that for 120 minutes a week, so 2.5 hours, you should be getting moderate, intense aerobic physical activity. So this is activity that's involving, 1 second. Sorry about that. Activity that is involving a larger muscle mass. So think your legs, for example, going for a walk, 30 minutes every other day or something like that. Or you could do less time, but more vigorous activity. So rather than walking, this might be jogging, for example. But the key here is that these are working larger muscle groups that cause you to kind of breathe heavier, right? So what we're doing is we're working our cardiovascular system, our heart. But really, that's not quite enough because as we age, we also have what's called sarcopenia or muscle wasting. So we have, just like in our brain, which we talked about, we also have atrophy of our muscles. And so it's imperative that not only as we age, but throughout life, that we do muscle strengthening exercises. So this is recommended to be done 2 or more days per week. And again, this is targeting the major muscle groups. So legs, arms, chest, again, to try to address that sarcopenia that occurs as an individual ages. And then again, as we age, the chance of a fall dramatically increases, unfortunately. I'm sure many of you are aware, but falls are a significant health-related concern, lead to numerous negative health outcomes. So it's also really important to do exercise that can maintain or improve balance 2 times per week. Now, what's nice about these, and I put these arrows to kind of highlight this, but there's sorry, I got muted. I hope I wasn't muted for very long.
Oh, you weren't, Joe.
Okay.
I did
All
just
right, good.
notice that you were not muted that long.
Excellent. So what's critical about this is it's oftentimes that we can do one activity that kind of checks multiple boxes. So an example is when we are doing potentially some leg strengthening exercise, for example, like a lunge, where we're doing a lunge, that is also challenging our balance system. So there is benefits to doing that, kind of checking 2 boxes at once, doing a strength training exercise while challenging our balance system. Oftentimes our cardiovascular training can target our leg muscles. So think of cycling, for example. So I just listed some common exercise-based evidence-based exercises. So there's, for the aerobic exercises, spin cycling. That's actually one that we use quite a bit for our participants. It is enjoyed by a lot of people, not necessarily everyone, and that's okay. But it certainly is enjoyed by many. If you go into most fitness centers, there's usually a room with spin bikes in them, and if there's a class, there typically tends to be a pretty full class. Another reason we really like doing spin cycling is because I mentioned falls. One of the unique aspects of our studies is that we go with high intensity exercise. And if we were to have a walking based intervention and I ask somebody to begin to walk faster, that increases the risk of a fall. But if I have them on a spin bike, I can increase the intensity or have them pedal faster without increasing the fall risk. So walking, jogging, very common targets. Strength training, there's programs for this. There's Ageless Grace, for example. Vivo is a company it's virtual based that I'm involved in, that I'm really excited about its growth. Balance, there's Go for Life. This is a National Institute on Aging program that can be found online. A lot of people are enjoying Tai Chi. That's a growing area that's really good for balance. We've done a few studies looking at Tai Chi and Parkinson's to improve balance. And then flexibility wise, that's another area that we should target as we age. Our flexibility decreases, which oftentimes results in us having less mobility. So increasing our flexibility is very, very critical. So I did want to make sure that we had time for discussion. Before I get there, I did want to talk about, some of the other programs that I'm involved in. So we are extremely interested in trying to figure out why it is that exercise is so good for the brain, and highlighted some work that we have ongoing in that area. But the other outlet that my team is working on is getting programs that are effective and that people enjoy out into the community. So right now, it is a challenge for people to access and have support when it comes to increasing their physical activity. You know, it's not necessarily as simple as the doctor saying you need to exercise more, and oftentimes the conversation ends there. You know, the person's could be very curious. You know, at the VA, I work with a lot of veterans, and you know, it's not uncommon. I have a 75-year-old veteran that comes into the hospital, and he says, you know, the last time I was given any guidance on what type of exercise I'd be doing, it was 50 years ago, you know, when I was in basic training. And there's a lot of confusion and misinformation out there. If you think about when you go to the grocery store and the magazines as you're checking out, you know, 30-second biceps, 30-second abs, there's a lot of confusing misinformation out there. So what we're trying to do as a team is really get these programs that can be successful out to people so that we can facilitate their want to increase their physical activity. And we typically find that many people are interested in increasing their physical activity. They just aren't sure, or they don't have the resources in place to do it. So one big thing that we've had success on the VA side, and we're trying to expand this, is with healthcare professionals being actually able to prescribe exercise. So on the VA side, there's a program called GeroFit. It started at the Durham VA in the 70s. This program has obviously been around a long time. And what it is a veteran goes to their healthcare provider says, you know, you should exercise more. Here's a script for GeroFit, and then they're enrolled in GeroFit, and they can actually go to a facility or exercise virtually. And this has been really, really successful. It turns out that when doctors write scripts, it actually increases people's adherence to exercise. So we really want to have that as one outlet where we can encourage more activity and increase the outreach of and options for people that are interested in exercise. I think I just have one or two more. I really am so thankful for the invitation and to share some of the work that we are doing with you all. I always appreciative of my colleagues and my funding agencies. And I think my next one is just opening it up for questions.
So there are, Joe, a couple in the chat. And then again, please feel free to put more in the chat or raise your hand. One of our guests just said, well, she was cute and funny in the beginning. I hope you cannot see me eating. I want to exercise, but I just find it very difficult. And I know you did go in kind of just to get started, but I guess, what would you say? Because after you are sedentary for a while, it is difficult to just be like, oh, okay.
Absolutely. Yeah. And that's kind of what I was alluding to. And this is not something that's uncommon to hear, but it is something we have to address. And there's a lot of different answers for this. One, I'd kind of start with you. I'd be interested in knowing what you enjoy doing. Do you enjoy being out? I'm in Atlanta, Georgia. We have a lot of good nature trails around. I'm always out with the kids walking around. Sometimes we jog. And that's just one of the things that I greatly enjoy. I also enjoy being at the gym, interacting with people, the social aspect of it. So really, you kind of think about what would work best for you. What type of exercise? Is it being in a pool? There's really a lot of good options being, swimming, and there's options being outside, being in a gym, a lot of different pieces of equipment in a gym. So you have to tackle what you would actually enjoy, and then kind of build out from there. Is it something that I want to do by myself? We find that the group-based exercise helps tremendously. Individuals, and it's okay. It's not uncommon for them to not be comfortable working out in a group setting in the beginning because, insecurities or not being sure if they're doing something right. But working through that and then having that social support tremendously impacts your kind of staying to it, and you develop those bonds with others in the group, and you start having a little more accountability towards one another, and it just really, really facilitates increased adherence to activity. So find something you like, hopefully find people you want to do it with, and then, kind of build from there. And it really does snowball. People often, in our programs, people will buy equipment after they're done with our program. Will buy equipment for their home because they want to be more active in their home, and then they find that they're just out doing more. When they go to the grocery store, they're parking farther away just so they can get those extra steps in. That's another aspect that I didn't really touch on that we're looking at as well is technology. So we have the ability to really track how we're moving and how that is impacting our health a lot different than we could, 10, 15 years ago. And people really take their step counters serious, their iWatches, and really stick to it. And towards the end of the day, if they don't make their steps, then they head out of the house and start getting those steps in to try to get to their 6 or 7 or 10,000 or whatever it is. But that's another thing that you could do as a way to really kind of challenge yourself day to day and making sure that you're meeting some guidelines that you set, some goals that you set for yourself. So, stick to it though. Whatever you try to stick to it.
Well, and I guess I was just going to add that when you said that about parking, and I find this with my parents too, is it's you can just start off small, right? I mean, you can just take a walk around the block, just park at the end of the parking lot, just add that little bit in. And you don't have to go for the huge 1 mile walk, 2 mile walk. You can just go for a couple blocks in the beginning. It doesn't have to be.
Absolutely. And there's nothing small, right? You're just starting off at a certain level and you're going to build. And it really is something that you want to target for the rest of your life. It's a lifestyle change that you want to make for your overall health, for your quality of life, and getting extra steps in, taking the stairs rather than an elevator. Those quote unquote small things add up to big things, and it really changes your approach to physical activity and your overall health. So I did bring up the chat, and I see some.
Yeah. Okay. So Dale, did you see? He said better doing some each day versus doing a lot in one day and then several days taking a break and then coming back.
Yeah, it's a good question, and a lot of factors here as well. The one thing is you try not to have too long of breaks. That's one thing that we find is that once you get away from it, it just each day gets easier to stay away from it, and so we try to avoid those big breaks, and all of us know that felt this before. You've maybe increased your physical activity and you're feeling good, and then you go on a vacation or something and it's 5 days or 6 or 7 days of being a little more sedentary, and then the challenge going back in and doing whatever that activity was that maybe wasn't that hard is twice as hard now. So those longer gaps can be difficult to overcome. We try to avoid that. We really want it doesn't have to be necessarily structured exercise every day, but you want to be active every day. You want to be moving around. I highlighted that study about sitting. You want to, as I'm sitting here now, you want to avoid those long periods of sitting, the days after days of sitting, and activity every day, whether it's getting up and walking around for a certain amount of time. That's really, really critical. Now, when it comes to structured physical activity, you got to factor in your schedule. Some of us have very different schedules. Some of us have I know nurses that work, seems like round the clock for 3 or 4 days, and then they have 3 or 4 days completely off. So their schedule is completely different when it comes to structured activity. I have young kids, so I wish I could have a full day where I could just get out and exercise all day, but usually it's chasing them around. But I think that the main takeaway is that you want to be up and moving throughout the day, every day. And your structured physical activity, if that's 3 or 4 times a week, that's great. If it has to be less because of a schedule, that's okay too, just as long as you're targeting, heart health, muscle health, and balance exercises.
So do you see the one there from Nancy? I think her question really more is that, if you're on medication, that does kind of slow down your activities and safety. Is walking still a good way to go? And then I think I don't know if that means 80 years and older, like how many steps or what should you really be looking at?
Yeah, the medication is a huge, it's something you have to take this into consideration. Any one of us that is on medication, particularly more than one medication, is at risk for a fall related to that medication. And you really need to know what the side effects of those medications are, if they're side effects because you're taking more than one or just the individual medication. But if you have a medication that causes, drowsiness or dizziness, you have to be really, really careful of what you're doing when that medication is sort of kind of at its peak and causing you potentially have an increased chance of a fall. So I do a talk on falls, and I always like to slip this in. It's called Slips and Trips, Don't Fall for them. It's one of my favorite talks. But we talk a lot about medications, and that's definitely a conversation. When somebody prescribes you a medication, they become responsible for all your medications now. So that person that, if you have different doctors probably, but if you have one doctor that gives you a medication, that doctor needs to be aware of the other medications that you're taking and can let you know of any interactions. But if you feel unsteady or dizzy, definitely be aware of that as you're, not just in terms of exercise, just in terms of moving around your environment. So certainly, yeah, very, very important. How many steps? So there's always been this number thrown out that it's 10,000 steps a day. And I don't know if I've ever seen it throughout the aging process. That's the magic number. There's also, what's interesting about that number is it's similar to the activity guidelines for how long we should be exercising. If you go back and look at the activity guidelines from 20 years ago, it's less, the number's less. And I believe that they raised that number just to try to get people to go closer to that and then kind of get to the old guidelines. So the 10,000 number could be similar. If we tell people 10, maybe they'll do 8. But the science, there isn't, at this point, we don't have a magic number. You certainly need to, maybe if you have something that is tracking your steps, you want to look at that every day for a couple of weeks and kind of get your profile. And then the goal is always to build, right? So if you're averaging 5,500 steps a day for 2 weeks, go for 6,000 the next month, again, to try to increase your activity. And the same thing, mix in maybe some flights of stairs and things like that, because you always want to increase, not stay kind of stagnant.
There's the one last one, Joe, I have a 67-year-old son who has been diagnosed with dementia. Would cognitive therapy help him at this stage?
Yeah, so cognitive therapy is, and I'm not in that area. I'm not a psychologist or cognitive scientist, but the cognitive therapy is kind of an umbrella term. There are cognitive training aspects of cognitive training that have been shown to be beneficial. Again, the science is still kind of determining what exactly the best thing is to do. There's not there's a newer medication, and even that's not certain there yet. So a lot of uncertainty. What I would say is that, and we have a program at Emory called the Cognitive Empowerment Program. It's for people with early on in diagnosis of dementia or mild cognitive impairment or Alzheimer's disease. And what it is, it's kind of a comprehensive program. And what it involves physical activity, it involves cognitive stimulation, it involves social support. So it's interacting with people that also are, have also been diagnosed. It involves exercise, it involves different variations of cognitive training. So really, is there one type of treatment that could potentially work? We don't know yet. I don't think, but really it's becoming engaged in activities, whether that's cognitive training activities or physical activities can definitely benefit. And from the standpoint of physical activity, it's also, we know that it's going to target, heart health, and we still have to think about that, whether we have dementia or not. We want to keep our heart as healthy as possible. We know that our muscles are going to atrophy as we age, and we want to target that, whether we have dementia or not. So, just some tips.
Perfect. Let's see. What effects on brain health do you see? So this is kind of back to that on off. Has there been any studies about like you're on for 12 and then off for 12? Like any effects that you do see? Like, does it decrease greatly because you were off for 12 weeks and then on, or does it kind of stay in there?
Yeah. So there is a backstory to why we have 12-week studies. I mentioned that I was at the University of Florida, and there's a lot of retirees in Florida and a lot of retirees that leave Florida for great reason in the summer. It's brutally hot down there, and it's not great. So they come in for the winter and then they leave for the summer. So when we were doing our very early studies, this was about 15 years ago, I really just, the holidays also play a role because people you start having people disappear around the holidays. So we needed, when it comes to studies, we need very sound control, and we need to make sure people are attending. So 12 weeks was the window, and I was okay with that window because we were doing a higher intensity exercise. And I thought that would be equal to a 6-month activity. So I say all that. And then my point is 12 weeks is never going to be enough. We have to change our habits so that we have increased physical activity. It's a lifestyle change. So across our whole lifespan, that we increase our physical activity and we remain active. As we get older, things are going to change, and we're not going to be able to do the same things we did when we were in our 30s, 40s, 50s, 60s, 70s, and we adapt, but we continue to be active in some manner. So, and that's why I emphasize that you got to find something to enjoy and hopefully find some social support as well, because you want to do these activities for the lifespan, not just 12 weeks doesn't work. Because I mentioned it too, when we go on, vacation or something, the benefits that you see in 12 weeks, unfortunately, they go away in about 2 or 3 weeks of being inactive.
Yes.
And I don't know why that is. I don't know why doesn't take 12 weeks to go away after it took 12 weeks to gain, but that's just how
right.
it is.
That is very right. Very unfortunate. You take a few days off and you're like, well, I can't actually run that mile anymore. I don't think a lot of the other things, some of the other questions, I think one I can even answer a little bit is, this is being recorded.